So you've decided to start practicing yoga, but you're finding it difficult to cultivate that habit, getting onto the mat every day and practicing, because some of the yoga practices, some of the yoga postures seem quite difficult and you feel quite sore the next day. So what I would suggest is to start your yoga journey with counter poses. So this video is about counter poses. We're going to talk about the importance of counter poses and what they are and how you can practice them. Hi, I'm Vidyut and welcome to my channel, The Yogeek Path. So what are counter poses? Counter poses are foundational postures that we include in our yoga practice. Counter poses are useful for neutralizing the negative effects of postures. Now, every posture, every asana that you do produces positive and negative effects. The goal of counter poses is to neutralize the negative effects so that you can return to normal and continue with either your sequence of postures or you can move on to your normal day-to-day activity. Not only do postures produce positive and negative effects, some postures, depending on the intensity with which you do them, can increase your heart rate or lower your heart rate. Doing counter poses helps bring the body back to neutral, to normal, so you don't carry the effects of the postures, of the asana practice into your next activity. So in today's video, we're going to go over some of the commonly used counter poses. We're going to cover Uttanasana. We're going to cover Cakravakasana to Balasana. We're going to go over Apanasana, Pascimatanasana, and Shavasana. Now, most of these postures are foundational and are effective in their own right. And just doing these postures itself could be an effective yoga asana practice, especially if you're a beginner and you're just starting your yoga journey and trying to cultivate the habit of getting onto the mat every day. These 5 foundational postures are perfect for you to get started. So we'll begin with Uttanasana. Now, Uttanasana itself can be is a forward fold, standing forward bend. It can be a complete workout in itself with all its variations. However, for today's video, for the purpose of using Uttanasana as a counter pose, we're going to keep it very simple. So I'd like you to start with your feet about hip width apart. Exhale completely, and as you breathe in, raise your arms up. And as you breathe out, hinge your hips back, initiate the movement from your hips, slightly bend your knees, bend forward. It's okay if your hands don't reach the mat. Then arms leading the movement, breathe in, come up. Breathe out, lower your arms. Breathe in, raise your arms up. Breathe out, hinge your hips back, start bending forward, slightly bend the knees, bend forward, pause, start breathing in, arms leading the movement, breathe in, come up. Breathe out, lower your arms. Breathe in, raise your arms up. Breathe out, hinge your hips back. Start bending forward from the hips. Slightly bend your knees. Pause. Breathe in, come up. And as you breathe out, lower your arms. Counter poses should be practiced dynamically. You don't stay in a counter pose, especially when you're trying to neutralize the effects of another posture. So counter poses are to be done slowly, dynamically, gently, because we're trying to neutralize the effects of the previous posture. So you can do each posture 4 to 5 times. Get your spine back to neutral. and then move on to the next posture. So the second posture we're going to cover as a counter pose is a combination posture. We're going from Balasana to Cakravakasana. So for this, we begin on our hands and knees. The wrists and elbows are stacked directly under your shoulders. Your palms are open wide. Your index finger is pointing straight ahead. Your knees are stacked directly under your hips. You're not leaning forward, nor are your hips back. Your knees are stacked directly under your hips, and there's a straight line from your hips to your knees. And from this position, drop your chest, retract your shoulder blades, creating some space between your shoulders and ears, and your head is in line with your spine. You're not looking down, you're not looking up, your head is in line with your spine. You should feel no strain on your neck. This is your starting position. This is Cakravakasana, also commonly called as cow. So from here, exhale completely. Take a deep breath in. And as you breathe out, hinge your hips back, pushing your hips towards your heel. This is Balasana. And from here, breathe in and come back to your hands and knees, Cakravakasana. And as you breathe out, push your hips back towards your heels, going into Balasana or child pose. Breathe in, come back to Cakravakasana. Now, as you breathe in, go back to Balasana. Now, for some people, might find it difficult to have a full knee flexion. You may have had knee surgeries or suffer from knee injuries or knee pain, and you might not be able to go down fully into Balasana. So you can modify that. You can support yourself. You can use some modifications. You can use something to soften your, create some space behind your knees, creating some space between your calves and your thighs. You can place a cushion or a bolster and then gently go into Balasana and come back. You can exhale, go into Balasana, go back as far as your body will let you, so you don't feel any pain in your knees. Breathe in, come back. Another modification or simplification of this Balasana. Now, ideally, we'd want to keep the whole elbows straight and locked without bending it, but this could cause a strain for some people. So you can bend your elbows and place your forearms on the mat. So these are two simplifications of Balasana. You can pick whichever is comfortable for you. The key is not to hurt yourself or push your body beyond its limit. And how do you know you've reached your limit? It's usually the indicator is a breath. Your breath is a very good indicator of whether you're pushing yourself or not. When you're in pain, you might either hold your breath. When you're straining yourself, your breath rate will increase. Your inhale will be quick and sharp. Those are indicators, and you need to be aware of your breath constantly so you know whether you're straining yourself or not. Especially as a beginner, we might be eager to make progress, but I think in this case, going slowly is better because you develop an awareness of the body, awareness of the link between the breath and the body and the mind. So don't push yourself, don't force yourself, just aim for consistency. So this is Balasana. So you can also go as deep as you want. Drop your forearms, drop your elbows to the mat. This could also be a variation of Balasana. So this is classically, this is Cakravakasana. And on exhale, you're going into Balasana with your arms straight and locked. But if this is difficult, you can just go as far as your body will let you. You can drop your forearms. You can place a cushion under your under your knees, so you can go into a comfortable child pose. And for some people, you might even want to place a rolled up blanket or a cushion under the knees to help soften the posture. To cushion the knees, making it a little bit more comfortable to do this posture. So you can use, so this is the second combination. So Cakravakasana to Balasana. Inhale, come to Cakravakasana. Exhale, go into Balasana. Inhale, Cakravakasana. Exhale, Balasana. Relax. Now, like I said, when you're doing this combination of postures, it is better to do this dynamically without staying in both postures for too long, and you can do this 4 or 5 times. So the next counter pose we're going to do is Apanasana. In Apanasana, the translation is wind releasing pose. So lie on the mat with your knees bent. Make sure your lower back is in contact with the mat. If it's not, gently lift your hips off the floor, tilt your pelvis forward, and gently place your lower back on the mat. Then bring your attention to your chest. Check if your rib cage is flared. If it is, drop your chest. So your middle back is in contact with the mat. Then bring your attention to your shoulders. We tend to hold a lot of tension in our shoulders and we tend to shrug. So bring your attention to your shoulders. If you're shrugging, roll your shoulders back and retract your shoulders, creating some space between your shoulders and ears. Finally, bring your attention to your chin. Check if your chin is up. If your chin is up, drop your chin so your neck is also in contact with the mat. Now, this might be uncomfortable for some people because we're not used to holding the body in this position. So you might feel some tightness either in your upper back, in your chest. You might find it difficult to breathe, but this is normal. So what you'll need to do is to combat this by relaxing. With every exhale, relax and let the spine sink into the mat. What will really help at this stage is to do conscious breathing, where you're breathing into the chest first and then into the belly. And then when you exhale, start by contracting your lower abdomen, pulling your navel towards your spine, empty the belly first and then the chest. This conscious breathing will allow your spine to relax and sink into the mat. It might take a few minutes, but give your body that time. And with consistent practice, it won't take that long. Now, once your whole spine is settled into the mat, you can lift your feet off the floor a few inches and rest your palms on your knees. Your elbows are straight and locked. You're not bending your elbows. Now, you can either rest your hands on the knees or place your hands to the sides. Usually in this position, we have a tendency to grab the knees and hold the knees tightly, but I'd like you to avoid that and relax and just gently rest your palms on your knees. Your arms here in this posture are merely guides. They're not doing any work. Keeping the arms here tells you this is your starting position. So exhale completely. Breathe in here. And as you breathe out, contract your lower abdomen, pull your navel towards your spine, and allow your knees to come towards your chest. And as you inhale, Breathe into the chest first and then into the belly. Allowing your knees to go back up. The movement of the breath pulls the knees towards the chest. The movement of the breath pushes the knees back. The work here is being done by your hip flexors and your deep core muscles. We'll have a tendency to pull with the hands, hold the knees, grab hold of the knees and pull the knees towards the chest, which means the right muscles are not being engaged for this posture. For this posture, we want all the work to be done by your deep core muscles and your hip flexors. So the hands are just a guide. So rest your palms comfortably, gently on your knees or on the sides of your knees. Exhale completely. Breathe in here. And as you breathe out, allow your knees to come towards your chest. And as you breathe in, let your knees go back up. Breathe out, allow your knees to come towards your chest. Breathe in, let the knees go back up. Breathe out, knees to the chest. Breathe in, knees up. Relax. Now, once again, as with all counter poses, do this about 4 or 5 times as a transition from one posture to the next. Next, we're going to look at Pascimatanasana, or the seated forward fold. This is also a powerful posture in its own right, but we're going to use this today as a counter pose, and we're going to do this dynamically. So Pascimatanasana, our starting position is Dandasana. So you're sitting on the floor with your legs extended in front of you. Your heels are pushed out and your toes are pointing forward. You're sitting with your back straight, your shoulders relaxed, and you're looking straight ahead. Now, for many people, this might be a difficult posture to start with. Okay, so there are ways of simplifying this. You can find a cushion or a bolster. You can elevate your hips and sit a little bit more comfortably. Also, you don't need to keep your legs absolutely straight. You can keep your knees bent. If you have tight hamstrings or tight glutes and lower back, this might be a comfortable position for you to start. So you can bend your knees, elevate your hips, but the key is to keep the back straight, absolutely straight. You can even do this sitting on a stool or sitting on a chair. If you're sitting on a chair, don't lean against the backrest. You come towards the front of the chair and place your feet firmly on the floor. But here I'm demonstrating this on the mat. So I'm demonstrating this. My legs are straight. My heels are pushed out. My toes are pointing towards the ceiling. My back is straight. My shoulder is relaxed. My chin is tucked in. And I'm looking straight ahead. Exhale. This is your starting position. Exhale completely. As you breathe in, raise your arms up. And as you breathe out, start by contracting your lower abdomen, pulling your navel towards your spine, keeping your back straight. Lean as far forward as you can. And then bring your hands to your legs. If you can't reach your feet, if you can't hook your toes, it's perfectly all right. What we're looking for is a forward bend where you're initiating the movement from your hips, keeping the spine straight, and you're leaning forward from the hips. So exhale completely. Breathe in here. And as you breathe out, keep your back straight. Start leaning forward. Lean forward as far as your body will go. And then bring your hands to your legs or your foot, or you can hook your big toes. But when you hold your feet or hook your big toes, make sure you're not pulling yourself forward with your hands. Once again, the hands here don't do any work. The work here comes from, you'll be able to bend further forward by using your deep core muscles and your breath to allow the body to fold forward. You're not going to force the body with your hands. You might end up injuring your lower back. I've done that in the past, so I speak from experience. Once again, exhale completely. Breathe in, raise your arms up. And as you breathe out, keeping your back straight, start the movement from your hips. Lean forward, exhale. Bring your hands to your legs. Then arms leading the movement. Breathe in, come up. Breathe out, lower your arms. Breathe in, raise your arms up. Breathe out, keeping your back straight. Lean as far forward as you can. And then bring your hands to your feet. Arms leading the movement. Breathe in, come up. Breathe out, lower your arms. Breathe in, raise your arms up. Keeping your back straight. Start exhaling. Lean forward. Breathe in, raise your arms up. As you breathe out, lower your arms. Once again, like all counter poses, I'd like you to do this 4 or 5 times. So you can come back to normal, lower your heart rate, and neutralize the effects of the previous posture. And the last posture we're going to cover today is Shavasana. Wow, just these 10-15 minutes of doing very simple postures has made me break into a sweat. So Shavasana, we'll start with lying down with the knees bent. And as before, like we did for Apanasana, we need to make sure that the lower back is fully in contact with the mat. If it's not, lift your hips off the floor, tilt your pelvis forward, and gently place your lower back on the mat. And then check if your rib cage is flared. If it is flared, drop your chest, making sure your middle back is in contact with the mat. Then bring your attention to your shoulders. Check if you're shrugging. If you are, roll your shoulders back, retract your shoulders, create some space between your shoulders and ears. Finally, bring your attention to your chin. If you're looking up, tuck your chin in, give yourself a double chin. So your neck or your cervical spine is also in contact with the mat. Exhale a few times and let the spine settle into the mat. And once that's done, extend your legs one at a time. Your feet can be apart. Your arms are away from the body. Your palms are open and their palms are facing the ceiling. Close your eyes and relax. And here you do conscious breathing. Breathe into your chest first and then into your belly. And when you breathe out, begin your exhale by contracting your lower abdomen, pulling your navel towards your spine. Empty the belly first and then the chest. Stay in this for as long as you need. And pay attention to your breath. When your breath slows down, you can also feel your heart rate come down and come back to normal. And when you're coming out of Shavasana, roll over to your left side. Use your right palm to push yourself off the floor. Let me demonstrate this from the other side. If you're lying in Shavasana, bend your right leg, roll over to your left. use your right hand to push yourself off the floor and come to a seated position. Now we do this because it reduces the pressure on your lower back. It reduces the pressure on the heart when you're coming up from a supine position. This getting up from a supine position, from lying down on the floor, gets harder and harder as you grow older. So if you practice this way of getting up from a lying down position, it reduces the strain on your lower back and reduces the strain on your heart as well. So these are the counter poses that we've covered today. Now Shavasana is really interesting. So some days you just don't feel, you're really tired, you've had a really long day, and you're exhausted, not just physically. Sometimes you're mentally exhausted from being in lots of meetings, or you've put in a lot of intense mental work, or your energy is depleted. Your colleagues, your work, your boss, your family, your friends, society in general have depleted, drained you of your energy, and you just don't have the ability to do any postures. Then I would just say roll out your mat and get into Shavasana and take deep breaths, and perhaps that is the only yoga practice you need for that day. Give yourself the permission to relax, rest, take time out and preserve your own energy. So Shavasana is great for that. You can use this between postures, at the end of a yoga practice, asana practice session, or just at the end of the day, or between meetings. Shavasana is not just strictly for the yoga class or for the yoga mat. You can do this whenever you feel your energy is depleted. So to summarize, we do counter poses to reduce or neutralize the negative effects produced by a posture. We use counter poses to bring the body back to its normal condition before we get on with either other postures or resume normal day-to-day activities of life. So you can do these individually by themselves, or you can do these sets of 5 postures as a complete workout. If you're a beginner in yoga, you can master these counter poses first before you decide to take on more strenuous postures. Now with these foundational counter poses, it's very easy to become aware of your breath and practice your breathing within the posture. So today we've gone over Uttanasana, Cakravakasana to Balasana, Apanasana, Pascimatanasana and Shavasana. Hopefully you will integrate these postures into your life and feel the benefits of deep breathing and these gentle movements in your life. Thank you very much for watching this video. My name is Vidyut. I'm a yoga instructor and I examine human behavior through the lens of yoga. If you like this video and you would like to see more such videos, please hit the like and subscribe button for more such videos. Thank you very much for watching.